That's our theme song. It's WCCA TV, right? Hello, I'm Dr. Lynda Young, and you're watching Health Matters, a production of the Worcester District Medical Society in conjunction with WCCA TV. I am a pediatrician here in Worcester, and I am delighted to have my two guests with us today. First is Dr. Lloyd Fisher. He's a general pediatrician and Chief Medical Informatics Officer at Reliant Medical Group in Worcester, Massachusetts. He also serves as the Chief of Community Pediatrics for the University of Massachusetts Medical Center, and he is the immediate past president of the Massachusetts chapter of the American Academy of Pediatrics. Dr. Fisher earned his medical degree from the University of Massachusetts Medical School, where he also completed his residency. And also next to him is Dr. Bev Nazarian. Bev is a primary care pediatrician at UMass Memorial Medical Center and associate professor of pediatrics at UMass Chan Medical School. Her primary interests include community pediatrics and advocacy, medical education, school health, and children and youth with special needs. She's the school physician consultant for the Worcester Public Schools. She is a graduate of the University of Minnesota Medical School and completed her residency training at Children's Hospital of Pittsburgh. Thank you and welcome to both of you. Thanks for joining us.
Thank you.
So we are going to be talking about something that is very important to us pediatricians and also very timely. And we are talking about the effect of the pandemic that it had on our children. So Lloyd, I'm going to ask you the first question.
Sure.
So you noticed that the impacts on children were really less about physical and medical impact of the virus, but what were other ways that that pandemic affected them?
Sure, Lynda, and thank you. Most children did not suffer the severe medical impacts of COVID-19 the way that adults and older patients or other people who have more immunocompromising and vulnerable conditions have. Of course, there were some children who did get very sick, and some of them were hospitalized and suffered some severe consequences. But when we look at children as a population, the majority of children were impacted by what I call the non-medical impacts. They had their entire life disrupted, their schedule disrupted. We had some children that went to school at home completely remote for over a year in some cases, and then others were returning into a hybrid model. Their activities were disrupted. In addition...
Can you explain a hybrid model?
Sure. So a hybrid model of school was done in a few different ways. Some districts would have the children go in person for a week and then be virtual for a week. Some of them had Monday and Tuesday in school, Wednesday and Thursday at home, and then Friday was sort of a makeup day. And every school district did this in order to limit the total number of people that were in the school building at any one time, in order to be able to meet the criteria, which was distancing of 6 feet and so forth. Mm-hmm. And the children really impacted really vary based on their home situation. For some children, their parents were able to work from home. They were able to be with them while they were doing their homeschooling. Other children, their parents were service workers. They were working in the hospitals. They were working in the grocery stores. They were other essential employees. And what we found, unfortunately, is that many children were at home by themselves, maybe with their siblings. And oftentimes these children were home doing education on their own at an age that you wouldn't necessarily think would be the best interest of the child to be at home. But these parents had no other option. There was nothing else they could do. So for these children, they were completely socially isolated. The only way they had to interact with their friends and their peers and their teachers through virtual mechanisms. Now, we as pediatricians and as parents have spent years trying to limit electronics, limit these virtual screen time. Exactly. And now all of a sudden we're saying, nope, the only thing you could do. So children were impacted by that isolation. We know that they developed all sorts of mental health concerns. We also saw a really scary rise in obesity during the pandemic. And this has been something that we've been concerned about for quite some time, but we saw a dramatic rise and an escalation of the increase in obesity because, again, these children were at home. Some children, of course, their parents had the means to make sure that they were still getting appropriate exercise. I know for my children, we live in a great neighborhood. We live on a cul-de-sac. Our children were able to go outside and run and ride their bikes during the pandemic. But for many of my patients, that was not possible. They don't live in neighborhoods where they could really run free like that.
And Bev, your experience in the clinics at UMass, did you find the same thing?
I do find the same thing. And I think that, looking at both my primary care hat and my school physician hat, in Worcester, as Lloyd was alluding to, in Worcester, we were remote for a full year. And that was not the case for many of the surrounding communities where there might be more resources. And so for our kids in Worcester who, were often more likely to have parents that are working on the front line and may not have had, people to supervise them at home or to help them with their learning, they were remote for a full year. And I used to always think, when I saw patients would say, oh, my exercise is gym. Well, we definitely saw this year that, kids need gym and getting out of their house and walking around schools. And so we definitely saw those issues with weight gain and just, kids feeling really isolated. So yeah, I echo all of those.
Yes, it really, and I think I'm so glad I have you here as guests because you saw this and you realize the impact that this has, and you're continuing to see the impact that we have. So, Lloyd, you had once said that this generation, the generation that we've been talking about here of children, will likely be defined by the events of the past couple of years. So how do you think that that will impact them as they grow up in this post-pandemic world?
Yeah, I think about children of different ages. So if you had a child who was in some of the younger grades when the pandemic began, kindergarten or first grade, their first introduction to organized full-day school was in this very different world. They were going to school first completely at home, then they had that hybrid model that we talked about, then they went back to school, but things still weren't exactly normal. They had the distancing, they had masks, a lot of the activities were curtailed. And also, these are children that are learning to read for the first time. And that's something that we've seen a very concerning trend of, the ability of the reading skills in the younger children. Now these children are in 3rd, 4th, or 5th grade. And I'm hearing from teachers, both from my own children's teachers, but also from teachers who are parents and others that I work with professionally, how they're really doing a lot of work in catching up. And they're doing an amazing job. I know that it's been a challenge for our educational professionals to do this. When we get to some of the older children, their entire way of socially interacting, the middle school, the high school children, they developed their social skills only through virtual mechanisms. And this is something that we've been concerned about anyway because we saw this trend, but now for a year, 2 years, or even longer. So I'm concerned about how are they going to now adapt. And we're seeing some of the evidence of this. We're seeing a lot more school refusal because children are just scared to be in large crowds, in large groups. They got used to that pattern of waking up a little bit later, maybe staying in their pajamas all day, not necessarily getting fully ready for the day the way we think about a typical school day or a typical work day. And it's been very difficult for them to adjust.
I'm going to go back to what you were saying about the reading skills, the verbal skills that these young kids need. And when they did go back, they went back in masks.
Right.
And so much of that is facial expression and reading and actually the kids can form their words by watching the teacher talk to them. And that just didn't happen.
And that's so true. And that was something, we know, this was a big challenge and there was a lot of different opinions about who should wear a mask, when they should wear a mask, when it was safe to not wear a mask. And whatever you think about the value of the mask wearing, we do know that it had a pretty significant impact on the ability to communicate and to convey those facial expressions and to learn how to form words. And I think especially about those children with learning disabilities, especially reading disabilities, who may require some additional attention. It was very challenging for them in their special education classes and the extra reading to be learning that type of skill without having that facial expression.
They pretty much got lost, I think, and that was a real shame. So I know we hear, oh, kids are resilient. They'll just bounce back. You know, this really didn't have an effect on them. I heard that, and I'm sure you heard that a lot too. Do you think that's true? Bev, I'm going to ask you. Do you think that's true? Are kids, are they going to
They
bounce
are really
back?
resilient, but there's going to be a lot of residual. And I think we're still seeing, many of these things, whether we're looking at mental health or, or just social interaction, sleep, have always been issues that we as pediatricians face. But I think with the pandemic, all of that has escalated. And so, we see more kids on screens because, during the pandemic, the only way they can interact with their friends was playing video games on screens. And now, I'll see with my son, oh, I'm talking to someone. But it's not the same as going out. And so I think that part is really hard. So I think they're resilient, but I think there is key stuff, as Lloyd was saying, that they've missed. And particularly some of those, you talked about the kindergartners and the first graders, middle schoolers who missed their first year of middle school, high schoolers who missed their first year of high school. And those years are so key for them, just learning how they interact with other kids, and, just becoming more independent and thinking. And all of those things, I think, just, they have an effect. I feel like that we're seeing some improvements, but it's, we talk about COVID as being a trauma. It's a trauma that's impacted all of these kids, and I think it will always have some kind of an impact.
Yes.
Even though I do think kids are resilient, and they always surprise us.
And it also depends on what what other factors are going on in their life. Again, if you were of a family where your parents were working multiple jobs to make ends meet. Maybe these parents lost their job during the pandemic, so they're not only dealing with the trauma of the pandemic and the social isolation, but they're also dealing with the financial reality of their family struggling to make ends meet. And a lot of these parents that, especially of our patients in Worcester, really struggled both with their work, both with their own personal interactions. And these parents themselves were going through trauma and tragedy and anxiety and depression. So if the parents were dealing with all these things, it's going to have an impact on the kids. So I think that's really the differentiating factor. Yes, lots of kids are resilient, but if they don't have all of those resources in place, it was a lot harder for them to be resilient.
Yes.
And just like with any trauma, people interact and react differently to it.
And I'm going to turn to you, Bev, because you see this with your clinic for sure. We talked about obesity. What were some of the other issues that you saw and continue to see that are really alarming?
I think mental health is definitely the one that is so big. Certainly during the height of the pandemic, we were just seeing, we as pediatricians have always dealt with a lot of mental health issues, depression, anxiety, eating disorders, all of those kind of things. And even prior to the pandemic, we did not have sufficient resources and therapy and supports for it. And then the pandemic comes along, and you have these kids who are just isolated, and they're home. And so, as Lloyd was saying, they stay up late, especially our teens. They're up all night. They're sleeping during the day. All of us know, if you don't get out of bed, and actually, do something. If you sleep all day, that makes all of it worse. And so we saw kids getting more depressed, more anxious, and we saw this impacting, we saw it in our clinics, we saw it over those many telehealth visits. I think during the pandemic, we weren't seeing kids with pneumonia, we weren't seeing kids with bronchiolitis and asthma or strep or ear infections, all of those things with these kids home and away from things seemed to disappear for a year. But what we were seeing is depression, anxiety, all of these things, and we were doing telehealth visits, working through that and trying to help these kids to connect them. So those things were, and then our ERs saw the ones that were the most severe, which were more kids who were becoming hopeless, kids who were becoming suicidal. And, seeing kids with we see eating disorders, but I've never seen the number that I saw during the height of the pandemic. And it affected everything. It meant that our hospital floors, which are usually filled with kids that have infectious things, were now almost completely with kids with mental health issues. And there was no place for them to go. There weren't hospitals that they could go to. There weren't adequate therapists. And so you have kids on a medical floor, which is not the place where you need to be if you're that severe.
Right. I'm going to really go off on a tangent here, because
Sure.
you talked about telehealth.
Yes.
Can you tell us, if you were doing those visits, can you tell us a little bit about what you did?
Yeah, well, first of all, prior to the pandemic, telehealth was something that had been talked about, but most of us as pediatricians had never done. But we also recognized that we wanted to be able to serve our patients, and everyone was isolated in their homes. And, in our offices, we were coming in all the time. We were seeing kids, for the babies who needed their vaccines and their well visits. But for the most part, otherwise, we were very much limiting that. And so telehealth was a way for us to be able to reach patients. And it was a way we had this technology roll out really quickly. So a telehealth visit, I think we would have all the trying to connect and the challenges of trying to make sure that everyone was logging on, knew how to get on there and where they had to be. And even though it sounds silly, it was substantial.
Yes.
But then you would be able to, it was actually really nice to be able to talk directly, particularly to teenage patients, and to be able to talk to them directly. And there was a lot of what we were doing was just common sense. Okay, you need to get up, you need to plan, and trying to find these things.
Yes.
But there wasn't a lot to offer them, Teenagers and are social beings. They thrive. Their social connection is everything. We as our parents are, as I know, having a teenager are not their priorities, even if they still love us. So and so we would do it. But then there are challenges to the telehealth as well. You want teens to have privacy, and you need to make sure that if you're talking to them about sensitive topics, that they're in the room on their own. And then you're also trying then to think about, okay, what can I offer them? Is it going to be medication? Are there therapists? Telehealth therapists were starting to offer telehealth. So that for a little, there's a small window where as that was converting, I could get some people, but that quickly filled up.
And just the very basic, you needed to have either a phone or a computer and internet connection.
Yeah.
And that was isolating to a lot of families. It was really, a lot of it was an equity issue.
Right.
And a lot of stuff was tried out, and I won't go into that because that's a whole other issue.
Oh, yeah.
But I think these are things that really you start thinking about it and go, wow.
Yeah.
That didn't work as well as we thought it would.
If you don't have Wi-Fi, if you don't have minutes on your phone, and that same thing goes to when you're looking at schools. If you're remote learning, and particularly in Worcester, everyone had to have a computer. They had to have, the city had to spend all their money on Chromebooks and Wi-Fi hotspots, and that was not a perfect system, and it took a while to roll out.
Yes.
But in our community, that was, and then you have multiple learners in the same room. Try and do a Zoom meeting when someone is sitting next to you trying to do another one.
Yes.
Doesn't work for us. It certainly doesn't work for our learners.
A second grader, a fourth grader,
Yeah.
a teenager.
Yeah.
That was because they all had to be in the same place.
If you have a
using
big
that.
house with multiple rooms, it works great. If everyone's in one room, which is the case for many people,
Yes.
that was really hard.
Yes. And I think all of these things, when you really start thinking about it, because so many people think, well, that probably worked out okay. They probably did okay with that. Well, maybe some did, but I think for the vast majority, it was really pretty disastrous. So let me sort of shift gears now as to what advice would you give to parents about all of this, and what would you like to see? How can you help them help their children at this point?
I think the first thing is to find out where the family is. I would say most families are doing okay. They're getting back to sort of normal life. But there's still a small subset of families that I am concerned about with what I would call an unhealthy level of anxiety. They're still really limiting social interactions. And maybe it's because they have a family member with significant medical issues and they're still very concerned about COVID as well as other infectious diseases. But for some, it's just this constant messaging, this constant fear that for a while, we needed to fear. We needed to understand that there was a lot of different things we needed to do to stay safe. But as time went on and as we're in a different place than we were a couple of years ago, some of that anxiety, some of that has still stayed there. So what I like to do with those families is first get a sense of what is that parent or that child scared of. Sometimes the parent has moved on from the fear, but that child, after hearing for months and years from their parent that we need to stay inside, that we need to stay away from people, that we can't get together with your grandparents. It's hard for that child, especially if they were young when the pandemic began, to just quickly shift gears and start to say, okay, I understand now. So for them, some of them may need some professional counseling. Others really just need that reassurance from their parents that it is okay now, and they need their parent to actually say that.
And yes, and parent that. So Bev, anything to add to that?
Yeah, I think that all of what you've said is really important. I mean, I think that I'm not seeing as many of the patients who have that anxiety. I think that I'm seeing a lot more of everyone kind of feeling, as we all want to, like, okay, this is done. And so I think it's really challenging to find that balance of, we don't want you to be anxious, but we also want to make sure you're doing all the things you can do to sort of prevent this, which is, and we finally got to take off masks in our office like a week ago. Like, that is like amazing.
Yes.
And we're seeing people. It's exciting. But I think like vaccines and all those things, pediatrician, I'm going to have to say here, like, COVID vaccine is still important. I say to my patients, like, look at all the things you're vaccinated against. Which one are you more likely to come in contact with? And I think it's hard because there's been just an overload of information that's been out there from so many different sources. It makes it very overwhelming for families to try and figure out. So just like, as Lloyd was saying, there's all this anxiety, and it can go both ways, and so, trying to realize, talk to your pediatrician, try to get good sources of information. But I agree. I think right now is the time to try to think okay, it's important to get involved in activities. It's important to, while screens will be there, get off and get out there and try to socialize. And for people to do what they feel comfortable with, but trying to be, to try and tamp down some of the extra anxiety, but also to have people say but you also need to vaccinate and do these other things that are important. Because we don't want to have this kind of situation again. Hopefully we never will.
Sure.
I'm hoping it's once in a lifetime or...
Right. Hopefully one and done.
One and done,
That'd
exactly.
Be really, very nice.
Yeah.
So I'm going to shift gears for you, Bev, because
Yeah.
I think the partnership that you have with the school system is really very interesting. Can you tell me either how that came about, how you engage with Worcester Public School leadership? I know that you had constant contact as medical professionals with the leadership in the Worcester Public Schools. And I think that'd be interesting to hear about.
Yeah. Well, maybe we help us first of all to say I'm a school physician consultant, and so my role in that is not like doing school physicals for the kids. My role has typically been working with our nurse leaders, because our nurses in the Worcester Public Schools are amazing, so I do a lot of consulting for them. But then when COVID came along, we've never seen school health anywhere get as much publicity as it did during the pandemic, because it was a time when we really needed people to come together. And I remember in Worcester, as we said before, Worcester was fully remote for a full year. And Worcester, I think, when we're looking at 2020 in the spring when things closed down, as I had mentioned, they had to focus their energies on trying to get people access to virtual learning, getting the Chromebooks, getting the Wi-Fi hotspots, whereas in other communities, that may not have been the issue. Everyone may have had a computer, and they could be thinking about, do we need plexiglass, and what are the other things we can do? And so as the year was winding down in talking with the school leaders, we were already starting to think about the fall and thinking okay, what happens? Are we going to be able to bring these kids back? We need to prepare. And we realized at that point, we really need to be, working with leadership to try and help prepare for that, because as they were breathing a sigh of relief, okay, finally the school year is done, we were thinking, well, what's going to happen? And that summer was the one where everyone had opinion about returning to school.
Yes.
And so I reached out to the superintendent at that time, Dr. Maureen Benenda, and including you guys at the table, said, hey, we have a bunch of pediatricians who are willing to be a resource. We have Dr. Fisher here, who was at that point the president of the Mass chapter of the Academy of Pediatrics. We have yourself, who have been the amazing pediatrician leader of our community for forever. Well, that probably is not the best phrase. For many years. And Dr. Christina Hermos, who is an infectious disease doctor. Dr. Mike Hirsch, who was, I think, very much the face of COVID as our Worcester Department of Public Health. Everyone, and just other representatives who said, we are ready to be your we're not Fauci, but we want to be able to help you. How can we provide information? How can we be helpful? And Mary Beth Miano, I don't want to leave her out because she was at that point working at Family Health. And they were agreeable to it. And they said, okay, well, what started initially was we started having weekly meetings, which were over Zoom, and Zoom was sort of a newish thing then.
It was.
I wish, and it really provided a silver lining, trying to get these people together. And at that point, all of these people, our school administrators, our buildings people, our school nurse leaders, all were at home. And we were the only people who were like out actually seeing, like we were actually leaving our houses to see patients. So we were sort of, front line, a different front line than you were thinking about in New York, where you were seeing all this scary stuff with adults. And so we started meeting in this very interdisciplinary group, and everyone was willing to meet like every week to every other week. And what started was initially kind of a Q&A where we were kind of the experts trying to bring, advice. We relied heavily on Lloyd because he was, working with the AAP very actively, but answering questions about 3 feet versus 6 feet distancing, masking or not, where can you get a COVID test, what kind of test is that? But as we progressed and got to know each other, it really became very collaborative. And all of the physicians in this group, we were all really focused on, we're worried about these kids. Like, they are not getting sick from COVID. We think they need to be back in school. We're worried about all the things we were just talking about. And the schools had like other concerns. And so we started having this dialogue. And what we realized from this is that we had a lot to learn from each other. And by being able to talk together, it became then, from this, oh, we're answering your questions, to this, let's bring our perspectives to the table and share.
I think I'm glad you were able to talk about this because and nobody realized this was going on. I don't think that they knew that this was all going on behind the scenes. So I'm very glad to hear that. We are down to just a minute, a little over a minute. Are there any other thoughts that you'd like to have or give us before we actually have to say goodbye?
Yeah, I would just like to say that I'm hoping that we all, whether medical professionals, education professionals, parents, government officials, learn something from this experience. And really what I'm hoping we take away is, first of all, when it comes to the technology, we learned what works and what doesn't. And whether it's in healthcare, whether it's in education, whether it's in social interactions, we've come a long way. And we should take the good pieces of what we learned and carry those forward. I also hope that we learn in terms of the messaging, and this is more for our public officials or all of us in leadership positions. I think one of the things that was really challenging for parents is hearing mixed messaging, different messaging, changing messaging, and I'm hoping that in the future we can really come together to have a more unified message.
Well, I need to wrap up, so I want to thank you very much for joining us. And I thought this was a really good discussion about what went on behind the scenes for our children, what it meant to our kids, and thank you so much for being with us. Thank you very much for listening. I'm Dr. Lynda Young, and you have just watched Health Matters.